Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in optometry. Discover a new show at itube.net/podcasts.
You're listening to The Mod Pod, a companion podcast to Modern Optometry, the go-to publication for full-scope ODs navigating the evolution of our profession. I'm your host, Cecelia Koetting. Join me every month to hear me speak with authors from each issue. We'll talk about their articles, get more in depth about particular points of interest, discuss how to apply tips and suggestions in real-life practice, and more. Hi, everyone. It's Cecelia Koetting coming to you from Denver, Colorado with this episode of the Mod Pod. Tonight, I am joined by Steven Sorkin, who practices at the Corneal Associates of New Jersey in Fairfield, New Jersey. He wrote an article on drugs that affect the cornea. Hi, Steven. How are you doing tonight?
Hi, good evening. How are you?
I'm good. It's great to have you on the Mod Pod. Before we jump into your article, I'd love if you could tell our audience a little bit about yourself and your practice. And what was your first concert?
Well, first of all, it's an honor to be here with my good friend Cecelia. And I practice at Corneal Associates in New Jersey, which is in suburban New Jersey, Fairfield. It's a 2 OD, 2 corneal MD practice. I've been in the practice 14 plus years now. And majority of my day is with specialty contact lenses, about 75, 80%. And, looped in with that, of course, is cornea, anterior segment disease, ocular surface disease. So obviously those go very well hand in hand. As far as my extracurricular activities, I serve on the board of directors of our state association, NJSOP, and also local society president, Essex County Optometric Society, and also involved in education with the Scleral Lens Society as well. Not as busy a lecturer as you are, but I do.
You're pretty busy. I see you just about as many places as I'm at.
Thank you. Thank you so much.
You didn't answer. What was your first concert?
Oh, sorry. That's easy.
No.
Billy Joel at Madison Square Garden.
Oh, that is a winner. I like that. That's a great first concert.
I'm proud of that one.
Yeah. So article was great, and I really appreciate it. It's always a good reminder to talk about drugs that affect the eye, not just the cornea, but just as a whole, right? And it's no doubt that both topical and systemic medications have an effect on our patients' eyes. Sometimes it's hard to get the information from our patients and our parents on what they're currently taking. So what do you do to ensure that you're getting the most accurate information?
Yeah, it's very difficult. As we know, case history and getting information out of patients is very difficult. Some patients will not be forthcoming with any of their medical diagnosis or their ocular history, ocular surgical history as well, contact lens history. And then you get some patients that bring in a bag of glasses or a bag of medications, and they have medication they've used for the last 10 years. They had a sinus infection 5-10 years ago, and they still have that bottle of amoxicillin in there. So it does get difficult to do. And obviously a case history is always evolving throughout the course of your meeting with the patient. So sometimes things will not come out till the very end when you kind of have suspicion that something's going on. So it does get difficult. Sometimes, having family members involved or even calling afterwards to try to follow up with either a family member or the patient. Some EMRs do have the ability to go in and look for, the ERX from other providers as well. So sometimes
that's a good point.
helpful.
Yeah.
But it is difficult, as we know.
Yeah. I mean, I'm at the university, so thankfully anything that's within the university or other doctors that they've seen, I can see it. But if it's outside that, and I remember being at the VA, it was phenomenal.
I was going to say, VA is great. You have every single medical record, every provider they've seen, every blood pressure, every A1C that they've had.
Oh, yeah.
It's great.
Oh, yeah. And I think, you probably, similar to I do, and most of our colleagues out there have at least one entrance like form that they're filling out, as well as maybe a staff member that looks at it. Do you still go through the medications with the patient to just verify hey, are you still taking this, this, and this, the things that maybe we know have more risk for eye side effects?
Yeah, for sure. I think that's a really good point to, reiterate every visit. You're still taking the systemic medication or this topical medication. For me, especially when I'm dealing with specialty contact lenses, I always want to ask them what solutions and what care they're doing, dropped, et cetera. So we want to make sure, number one, that they're using the right stuff and also that they're using it correctly as well.
Yeah, even as ocular surface disease, and I'm not doing or fitting contact lenses, I still ask everyone about all those things with the contact lenses because it's so important.
And even, I was about to say, excuse me to interrupting, even holistic medications or
Yes.
non-RX medication that people may be taking, it's very important.
And that's a great point because a lot of patients don't think that those are real medications, right? They're over the counter. And I ask about sleep aids all the time and they say, yeah, I take Benadryl, right? And what does that do to the ocular surface and the dry eye, right?
Sure.
Yeah.
Especially this time of the year.
Yeah, absolutely. So because there's so many medications that affect the cornea and the eye, do you have a good resource that you use to look up possible ocular side effects? And how do you keep up with new medications that are coming out?
It's difficult because things are changing so often. There's so many new medications that come out, and it's very hard to keep up on what's new and new indications for existing medications as well. So you just try to read journals and go to conferences and read things. That's really the best way to do it. And of course, I'm sure like you, once in a while, I'll come up with a medication that I'm not familiar with, or not heard of, strange name, and what do? You just, excuse me, I'll be back, and then you just go into your office and take a look online.
Consult Dr. Google.
Exactly, it's true. We all have to do that.
I do. I had a patient today who was coming in on Tivdak for her uterine cancer. And so I knew that there were risks, right, as there is with a lot of those medications. And I was like, okay, what exactly do I need to be looking for? But I mean, I definitely quickly looked it up to figure out, okay, what tests, what should I expect to see, or what am I concerned about? So
yeah, for sure.
Yeah. So one of the things that you did discuss is oral keratopathy. And we know that there are a lot of different medications that can cause this. Do you have an acronym that you remember from school for?
I'm not good with acronyms. Some of my students,
No?
I have externs in my site, and they sometimes come up with these acronyms that I don't remember ever learning, but they come up with them, which is good.
Yeah.
But no, I don't. Do you have one?
I have one, chai tea.
Okay.
Like I drink chai tea, right?
Mm-hmm.
CHAI chloroquine, hydroxychloroquine, amiodarone, indomethacin, and tamoxifen.
There you go. Okay, that's a good one.
That's the way my brain works.
Is it too late for me to revise my article and put that in now? Or
right? But the other thing that you did mention, which I think is really, really important, is that there is the genetic disorder Fabry's disease, which can also cause oral keratopathy. How do you know when it's medication versus Fabry's in the specific thing that we're talking about?
I mean, most of the Fabry's start younger in a lot of cases, and the main thing to look into is these symptoms, like the extremity, like hands and feet will get numb and tingle. That's a big one. You can get ear issues like ringing, and deafness is one thing as well. GI issues, which obviously can mimic a lot of different things, but those are the things, if you ask patients these extra questions, that'll sometimes tease out potentially looking into Fabry's. And Sanofi, which is a company that has a medication for this, has a really good resources on it. If you're interested in learning more about it, but you can save a life with diagnosing this condition for sure. And then again, like you had asked me earlier about asking about medications. So what medications are you on, or have you been on, and that sometimes will help you get to the right place.
Yeah. So kind of two things being the age, does this make sense? And two, medication. And if you haven't been on one of those, why are we seeing this? Those are some really great key points. And yeah, can you say the name of the company one more time for our audience?
Sanofi, Sanofi.
Perfect. Yep. And they do have some really great resources. I've used them in the past. And I think it's always good to be aware of something like that.
Yeah, we had in one of our local societies a couple of years ago, they sponsored one of our meetings, and they brought in a patient with
Oh,
Fabry's.
really?
And they brought in a slit lamp and they actually had everybody look at it because how many of us have actually seen this? And it was actually really remarkable. And hearing the patient's journey and story was really touching.
Yeah, when you diagnose one patient with that, you may as well be diagnosing multiple because it's usually familial and genetic,
Genetic
right?
risk,
Yeah,
exactly.
yeah. What other corneal side effects do you think are important to be aware of that you didn't have the time or space for in the article?
Yeah, there's one, it's not corneal per se, but it's anterior segment is Dupixent is one of those. And I actually wrote an article for Modern Optometry about 2 years ago just on that particular drug. So if anybody's interested in reading up on that, I do have that is available. It was actually a keratoconus patient of mine that had had bilateral Dupixent-related conjunctivitis. So with keratoconus coupled in with it, it's very important to know that it's a very widely used drug now for a lot of different reasons, asthma, atopic disease, et cetera. So that's something to, you can just write a whole article just on that one drug.
Yeah. Well, great. Finally, I'd love to ask, what is your message or wisdom that you'd like to impart on our colleagues?
I think one of the things in our profession, we're just expanding and growing. And I think just being very passionate about what you do, being eager to learn about new things. I always say to my students every day, every patient encounter is different and you're always learning, even at this point in my career, I think you're still learning all the time. Every new patient is teaching you something different or a different way of approaching something, different way of saying something. I think it's very important. The other thing I would just say is just please get involved. There's a lot of wonderful organizations, the AOA, the Academy, SLS is one for me, the IKA, International Keratoconus Academy. There are just so many different organizations within our profession to get involved in different things.
And those are the organizations that help us grow and fight for our ability to have our scope of practice and continue to grow, right? For those of our audience members who want to know more or hear more from you, where can they find you on social media?
Well, again, I'm not as prolific as you, but I am on Facebook under my name. I have Instagram, which I really don't use a lot, but I think my name is s.sorkin, and then also in LinkedIn as well. I think those are the three that I do. I'm not too fancy. I don't do any of the other stuff, but that's kind of where you can find me.
Well, Dr. Sorkin, thank you so much for joining me on the Mod Pod. I'm sure our audience enjoyed it just as much as I did. And don't forget to read his article in the May-June edition of Modern Optometry.
Thank you so much.
Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in optometry. Discover a new show at itube.net/podcasts.
So our next guest on the Mod Pod, we are joined by Jen Wademan, who is owner and optometrist of Bidwell Optometry in Folsom, California. She is talking to us about her article in this month's Modern Optometry, Eye Makeup Trends and Eye Health. Welcome. It's great to have you here.
It's great to be here. Thank you so much.
Absolutely. And for the audience, would you mind giving us a little background on who you are and a bit about your practice?
Of course. I graduated quite a while ago from Southern California College of Optometry. Soon after graduation, I bought into an existing practice. I partnered, which eventually led me to buy out that doctor as he was kind of transitioning to retire. So ever since then, I've just been practicing and practices primary care, emphasis on, ocular surface disease, dry eye, myopia management. I feel like I get to do a lot of fun things, a variety of different things as a practice owner. I get to tap into different skills, not just doctoring skills. I do a little bit of stuff online. I think at this phase in my kind of career, contributing in different ways, whether it's like writing articles or being a part of a podcast. It's kind of continuing, kind of looking for just opportunities to contribute and just learn and grow and all those good things.
Wonderful. So the question is, who's the most famous person you've ever met?
Oh, good question. Well, my favorite, I mean, I wouldn't say, how loosely can we say met?
We can say pretty loose. Yep.
Okay. I was in the same room as Keanu Reeves.
That totally counts.
He was like my crush, celebrity crush when I was younger, and actually probably still is.
Many of us of our generation. Yep, I would agree.
Yep. So I went to a movie screening and and he was there and I was like, oh my gosh.
You get to geek out a little bit. Yeah.
Oh, totally.
I love it. So speaking of trends, you mentioned in your, because I loved reading this. This was great. Your article was just on point. But you mentioned the Vaseline trend, and I've actually had patients in the past who have used Vaseline at night, just for keeping their skin from getting dry. Or actually, I've had some patients in the past who said they use it to help remove makeup. But the trend you're talking about is a little bit different. Would you mind telling us and the audience about what the Vaseline trend is and what kind of concerns it brings for us in eye care?
Yeah, definitely. So this is a viral beauty trend to help keep the eyes from watering and ruining makeup. So essentially, you're putting like a dab of Vaseline, which is, petroleum jelly, along the waterline or at the corners of the eye. And so it's used kind of as a quick fix to prevent smudging, running of makeup, all of the like. So I think that's probably what it should be, is just a quick fix. Definitely not a long-term solution to watery eyes, because we all know watery eyes usually indicate an underlying condition. But the couple concerns is just using an occlusive agent or ingredient like Vaseline. It's thick, it acts as a barrier. Think of like saran wrap kind of preventing moisture out. Is that the meibomian glands, the potentially leading to styes around the lid. Another concern is just like infection. I don't know about you, but my Vaseline tub at home, it's been used for a lot of things, hands, lips, cracked feet. And I'm like, oh, dipping and then putting it near your eye. So it's not sterile necessarily, that little tub you have. Another concern is like milia, which are those little teeny tiny white bumps we can get around the eyelid skin because it's the thinnest skin on our body.
Which we already asking about, right? And it's like, how do I get rid of those? Well, don't put Vaseline on there or petroleum jelly, right? That's not going to help it.
Yep. Yeah, 100%. So, but yeah, it's, usually signaling an underlying issue. And so it's a quick fix, but you definitely need to,
don't want to lean on that one. Yeah.
Yes, 100%.
So the other thing that you mentioned that lash tinting. I mean, it is bad enough when it's done by Lash Tech. I literally yesterday had a patient who came in, lids are completely swollen, and she's like, yeah, I had an allergic reaction. I'm like, yeah, no kidding. But what you're talking about with this trend is that they're actually doing it at home. Can you catch our audience up on this trend?
Yes. So, you get online, if you, search for lash tinting, you'll come up with a bunch of different reels and videos about like do it yourself at home. And so the idea is for minimal effort to kind of enhance the lashes overall without using mascara. So basically it's a dye that you're putting on the lashes to darken them. It's not going to make them fuller, but darker like you would with mascara. But at home, at home lash kits, even like other dye kits like beard dyeing kits, and like hair dye kits could potentially, those definitely are not suitable around the eyes. They have ingredients in them that have a long history of issues within eye care, and a bunch of concerns. So it's the at home that kind of, you see these videos that look pretty effortless and easy. And I think it gives a false sense of safety, like, oh, everybody can do this and there's no consequences, or, there's limited side effects. And it's, a lot of that stuff is not regulated. There's, little to no disclosed ingredients, or kind of trying to figure out what are even in these products. And so that's where the concern lies. Just a lot of different issues can arise.
Well, and I know that I even get yelled at from my person who does my hair, right? If I use at home chemicals to dye, right? Because just there's all of these different ones that are just available over the counter that aren't great for our hair to begin with. So let alone, lashes on the eye, not a great idea.
You're a very important, sensitive part of your body. So yeah, it was really interesting to kind of dive into that, and the history of lash and brow tinting. And even if you get on and you search, like, okay, let me see what I can find as for a lash tint at home, and there's lots of options, and it's really hard to figure out the ingredients. And then sometimes there's claims where it's 100% natural, and I'm like, there's no way it's 100% natural. And it's there's no verification, or there's no, it's just, you can put whatever you want out there. And so
Cosmetics, FDA is just not really involved. It really is the wild west.
Free for all out there.
It really is, yeah. And in this age of instant and plentiful content, both us and our patients are constantly exposed to a barrage of new things, new trends, all of this that you're talking about. And, some of them might actually be helpful. Some of them that we were just talking about, not necessarily, right? But the problem is that there's no fact checking on a lot of it. And so some of it's true, some of it's not. But when we go to talk to our patients, it's difficult, because unfortunately these influencers are really becoming the people that they turn to and trust when it comes to some of these things. Do you have any words for our colleagues, or things that you've been doing on how to have a discussion with patients about some of these trends, and how to make sure that they know that they really need to talk to us?
Yeah, I guess it starts with us asking questions, and from there educating. I guess we haven't, it's not like we're new to this. I was thinking about this question in terms of contact lens and contact lens overwear, thinking about it in terms of lash growth serums, and, how I think we've all experienced, you're in the exam room and someone's saying, I'm sleeping in my lenses, for the last 4 weeks, or whatever the case is. And it's I don't think the best approach is necessarily to reprimand. I try to put myself in the place of a patient, and what would help me to change maybe some habits that I have that maybe are not the best for me, reprimanding me, probably I'm going to be offended, or I'm going to be defensive. But just educating, and how do we, letting the patient know, this is what we know, this is what can happen. Ultimately the patient has to decide not to do it. I can't hold their hand and point my finger. I can educate them, I can talk to them, we can have the conversation. I can make it a point to be like, wow, your lashes look really long. Are you using any lash enhancements? Or if we talk about, someone's talking about dry eye, then you can go through and ask questions like, are you using any kind of at-home kits? Have you done any of these enhancements? And I think it just opens the door for conversation in a manner that helps the patient to understand that, oh, maybe I don't want to do this, I didn't know that, or sort of in that direction.
Like you said, opening that door for conversation and shutting that door by telling them, by scolding them. They're not kids. Well, some of them maybe, but we want them to talk to us and we want them to trust us. So
Yeah, 100%.
that's super helpful. So since you actually wrote this article originally and between then and publication, we know a million new trends have probably developed. Are there any that you didn't cover that you think we should be aware of?
I just came across one. Actually, my daughter told me about it. I have a 13-year-old daughter, and she's very privy to all these like beauty hacks and skincare, and she's just at that age. And I haven't had a chance to like thoroughly like vet and look into this, but it's using Aquaphor on your lashes and to enhance your lashes, like define them to make it look like kind of a wet look, because to kind of more natural look. And so I was like, well, how does that compare to Vaseline? And
that was my immediate thought was, well, okay. Yeah, are we in that same boat?
Yeah, Aquaphor, when I was looking into it, Aquaphor it's like 40% occlusive, and then the rest of the ingredients are like humectants, so kind of water attracting, and then lanolin, and so perhaps like an allergic reaction to lanolin and could be an issue. But I thought that was interesting. I'm like, oh.
Which lanolin is in the base of a lot of the gels and ointments that we use that are ophthalmic. Yeah, so and that is the number one thing, especially like erythromycin ointment, that people will have a reaction to. It's not actually the antibiotic; it's the base.
Yeah.
So yeah, I'd wonder that too. But I don't know. You can catch us up later in another article on that one.
I'll tell you another one too, which is this, like, there's a lot of these trends that just get resurfaced in different ways or revived in, like, it instead of like a new makeup trend, this is going to, and maybe this is because of my demographic and this is what comes up on my algorithm, but like makeup over 40. And the thing that keeps resurfacing is water lining. And I'm like, haven't we talked about this before? Yeah, I know.
We did when I was in high school and early college. Yes. No, I'm good.
I know. I'm like, it keeps coming back, but the idea is your water tight lining. It opens your eyes up, so it lifts your face up. And so it's kind of like a new spin on an old thing. So there you go.
Fun. Oh, fun. Our meibomian glands are screaming at us as we talk.
Right? I know.
Yep. So in the last moments here, I would love to give you a chance to see what your message or wisdom you would like to impart on our colleagues.
That's always a hard question. I feel like, there's so much out there. I would say what's always been important to me is just patient focused and centered around the patient. It's kind of been my philosophy, and continuing that with like having conversations. I mean, we're in a pretty amazing field that we can have the conversations. We have, not always, but sometimes we have a little bit more time versus different settings within healthcare. We ask a lot of questions about occupation, about hobbies, about lifestyle. And so, we're in a good place to kind of, that patient-doctor connection, that connecting with your patients in meaningful ways, in tangible ways to help vision and eye health. I mean, I would just say that, like, continue to keep that at the forefront and the emphasis in all that we do, in terms of, all these things that come up, whether they're beauty trends or other things.
Keep the humanity in optometry. I like that.
Yes, exactly.
And for those of our audience who want to know more and hear more from you, where can they find you on your social media?
So Instagram, I'm Dr. Jen Wademan. Facebook, I have my practice on there, Bidwell Optometry. LinkedIn, Dr. Jen Wademan. I have a website. I haven't had a chance to update it recently, so it's been off in the foreground, but that's drjenwademan2.com. So
wonderful. Well, thank you so much for joining us on the Mod Pod, and maybe we'll have you again soon with one of your next articles.
That would be awesome. Thank you.